My knee was really in a torturous condition. Some work-related injuries, some sports-related injuries. The escalation of the years as they go by, everything started to take its toll on my knees.
Some people just have a thought process that bigger hospitals have more technology and things of that nature, but that's not so here at Griffin Hospital. We use the MAKO robotically assisted total knee system. It affords me a great amount of precision, which allows me to correct deformity, have people ambulate the same day after surgery, and at 2 weeks, they are walking and functioning back almost to their regular activity level. So the MAKO surgical robot has made this procedure much more precise. It has eliminated some of the painful soft tissue procedures that we have to do to balance the knee. We can usually do it now with the information that's in the robot by doing bony cuts. So that takes away some of the pain after the surgery. It will give us better correction of the actual limb alignment, and it's going to fit precisely due to our preoperative CAT scan planning. I see patients, which I didn't usually see manually, come in at 2 weeks, and they usually have zero full extension, almost 90 degrees of a bend of the knee, and walking with barely a cane at 2 weeks, which is hard with a total knee.
I'm very thankful that I had the MAKO robotic surgery because it eliminated the pain that I had in that knee, and my whole energy system is like I was 20 years ago.